Here in the second part of our first module, Introduction to Biomechanics, we're going to focus and discuss the different subdivisions of the field of biomechanics, and the one that we'll spend most of our time, if not all of our time in this course, relates to the biomechanics of rigid bodies. And the major prevailing assumption here is that when examining the biomechanics of a human or different parts of a human, we assume that those parts are perfectly rigid, and we'll work through a brief example of this shortly. And this is a major approach that's often used when analyzing human movement. And there are two approaches that we will take in this course that are part of the study of rigid bodies. The first is referred to as the study of statics, and that refers to the study of rigid bodies in a resting state. So bodies or parts of the body are not moving. Versus dynamics, which actually involves the study of biomechanics of rigid bodies in motion. The key term here are bodies experiencing acceleration. And when we get to the kinematics unit, we'll explore that in greater detail. And once again here, the overriding assumption when analyzing human movement is that the part of the body that is actually moving does not deform. Now in this example here, we're going to focus on a person performing a typical exercise that you might find in a rehabilitation clinic. So here we see a person performing a single knee extension where this elastic tube wrapped around the foot attached to the table provides additional resistance to holding this position right here. So the biomechanical problem we might ask in this situation is what are the forces that are exerted on the knee joint when performing this typical exercise such as this. And so what we do here is we focus and limit our examination to only the part of the person that's moving or just the part that is performing the exercise. So we're not going to concern ourselves with the left leg, the hips, the arms, the low back whatsoever. So we're just going to focus on this lower part of the right leg. Once again here, we assume that the lower leg and the foot are not bending, they're not undergoing any type of deformation. So the shape of it is retained all the way through the movement. So what we do here, instead of focusing on the entire person, we'll just zero in on the actual limb in question. So one particular question that we will ask throughout this course in situations such as this, the question here is, how much force must the person generate to hold the leg in this position? Keep in mind that the weight of the leg and the foot is something that the person's muscles have to work against, in addition to the force exerted by that elastic tube. And so to find a solution, we first have to go to anatomy. We have to ask, what is the muscle group achieving this task? And so from your anatomy courses, you know that in order to hold this position, the knee extensor muscle group acting through the patellar tendon inserting onto the tibia is responsible for this action. Once again here, we assume no change in shape of the lower leg and the foot, and we also know that the lower leg and foot are in a static position. You know it's in a static position because the question posed it here. The question asked how much force is necessary to hold the lower leg in this position. So there's no information that relates to movement. All of the information in this problem suggests that the leg is being held in this position. Even if it's for a few seconds, we assume and that the situation and approach the situation in a static manner. The second subdivision of biomechanics is this area called deformable bodies. Now we know in reality that different parts of the body, the different tissues, do in fact undergo a change in shape. So what we're really studying in this subdivision are how biological tissues respond when they have forces imposed on those tissues, and when those tissues undergo a change in shape, what kind of forces do those tissues generate on other biological structures. And that falls under the general category of what is termed tissue biomechanics. And this is something that we'll focus on at the very end of this course, in the final module. Under the subdivision of tissue biomechanics, it's further focused on examining the biomechanics of hard tissues, bones and cartilage, or soft tissues. And these are just some examples here. So when we talk about ligaments, tendons, muscle, skin, blood vessels, those are tissues that will deform to a much greater extent than bone and cartilage, and therefore fall under the branch of tissue biomechanics referred to as soft tissues. So in this illustration, or in this photo we see here, a very high velocity task such as pitching a baseball, when we slow it down and capture a still image, we see that the pitching arm undergoes a great deal of deformation. And so in this position, we know that a tremendous amount of stress is placed on the medial side of the elbow. And so focusing on the anatomy of the medial elbow, the ligament that provides stability to it is the ulnar collateral ligament. So in this illustration, we see an ulnar collateral ligament that is torn, but for a ligament to lose its function, it does not necessarily have to tear. If it stretches beyond its usable length, it will no longer provide the stability to the elbow that is necessary to carry out this task. Another common example under this subdivision of deformable bodies or tissue biomechanics relates to a major ligament of the knee that provides stability, referred to as the anterior cruciate ligament. It's a ligament found on the interior of the knee joint, and in order to understand how this ligament serves its function to provide stability, we need to understand that all ligaments do experience deformation, which refers to a change in the shape of a structure. And in this illustration, we're referring to a change in the shape of the ligament. So when we think about deformation, tissues will compress, or they may elongate, or they may twist. In this particular example, the anterior cruciate ligament, as all ligaments, carry out their function by elongating. That is a normal process, a normal function of ligaments. But the big question here is, how much can a ligament stretch before it actually starts to tear and lose its function? So when we discuss tissue biomechanics in the final module of the course, we're going to focus on how much deformation is quote-unquote allowable until that ligament starts to tear. And a major focus of many researchers asks how much force is necessary for the ACL to actually tear, and what type of athletic activities puts a person's knee at risk for an ACL tear. And so in this illustration, we see, if we focus and zero in on that major stabilizing ligament, the force that would induce either a micro tear, a partial tear, or in other cases a full tear, are tensile forces. So the movement of the knee will stretch the ligament. That is a normal thing that should happen. However, if the movement of the knee is even slightly excessive, that will pull that ligament too much, it will start to tear. The third subdivision of biomechanics that we will not focus a great deal on in this course falls under the category of fluid mechanics, and that refers to the study of biological fluid flow behavior and mostly human aquatic performance. In other sports such as cycling, air is considered a fluid, and so a major focus of research and application in the sport of cycling relates to how different pieces of equipment, the bike, the position of the cyclist, the helmet, can reduce the resistance of the air to their forward movement. So in a couple of examples here, here we see a person swimming, and as a person swims, they experience a number of different forces. So they do experience gravity that we just simply refer to as their weight, and that gravity will tend to pull them in a downward direction. However, the force of the water on the person gives that person buoyancy and is influenced by the biological tissues, by their body composition. Because of the action of their feet and their arms, they will produce what's called thrust, and thrust is the force that's going to push the swimmer in a forward direction. However, moving through a fluid, the person will also experience what's called drag, an opposing force to their forward movement that is proportional to how fast they're moving and proportional to what's called their effective cross-sectional area. And that's something we'll address a little bit later through some practice problems. In terms of biological fluid flow behavior, on the right-hand side, these are this is a major illustration from a research study published in 2013 that focused on the velocity, how fast blood flows through the cardiovascular system. And in this particular experiment, the researchers set up a computer simulation, a model of a blood vessel. And so the scale here in the middle is a color-coded continuum indicating slow blood movement here in the blue versus very fast movement of blood here colored in red. So on the left-hand side, the researchers modeled what's called a healthy aortic valve. And so we see the valve here. This is the valve that separates the left ventricle from the aorta. And here we see in light blue a really wide aorta. Here we see a wide opening through the aortic valve. The dark blue represents the thickness of the vessel wall, and we see that very wide movement, and so, that wide gap. And what we see, moving over to the scale, the light blue suggests to us that the blood flow is on the slow end, the very slow end. On the right-hand side, here we see a modeled aortic valve that is stenotic. So a stenotic aortic valve is one that has a pathologically narrowed opening here at the very bottom that you see. And what usually accompanies a stenotic aortic valve is a much narrower lumen of the aorta. So here we see a fairly thick vessel wall, and we see that blood flow is colored red here, indicating that it's moving very, very fast. And so what we conclude from just observing this illustration here is that the shape of the interior of a blood vessel will have a significant influence on how fast blood flows through these vessels. Because the rest of the body requires that oxygenated blood coming from the left ventricle, a diseased valve, a diseased aorta will result in a much faster movement of that blood flow to keep the same volume of blood delivered to all the tissues. That will have an additional pathological effect on the left ventricle. So this example here on the right illustrates to us that even when we have cardiovascular or physiological interests or applications in mind, the biomechanics of the moving fluid is something that needs to be considered. So this ends the second part of our first module, and then we'll pick up with our third module, where we'll take a more focused view of the approaches we take in biomechanical analyses.